Susannah Fox is known as an internet geologist, one who studies the patterns and changes at the intersection of healthcare and technology. Associate Director of the Pew Internet and American Life Project, Fox researches the impact of the internet on families, communities, education, and healthcare. Her emphasis is on peer-to-peer healthcare and how the internet can affect people living with chronic illnesses. Fox's current project focuses on the number of Americans engaging in self-tracking, either for themselves or a loved one. Can you talk a little bit about some of the main research findings that you presented today?
So we get to do a health survey about every 2 years. In general, we study the social impact of the internet, and we look at different aspects of life in American society, and health turns out to be an area where the internet is having a significant impact. This year we decided to go more deeply into engagement, and that in this case meant self-tracking. We had done a couple of survey questions in 2010 and gotten some feedback that we really weren't asking a broad enough question to capture really what Americans are doing. So we broadened it. We asked of all adults, do you track your weight, diet, or exercise routine? 60% of American adults say yes. 1 in 3 American adults say they track their health indicators or symptoms like blood pressure, blood sugar, headache, sleep patterns. And 1 in 3 caregivers, and here's where I think it's really important, because so much of the front lines of healthcare are people who are caring for a loved one at home. 1 in 3 caregivers are also tracking health indicators or symptoms. Now, a follow-up question found that half are tracking in their heads. And, I joked and said, really the only tracking that I personally do is whether I fit into my skinny jeans.
Right, and I raised my hand when you said, how many women out there have a pair of skinny jeans at
And there
home?
might be some guys who have some skinny jeans. And so that's a lot of where we are today, that there are 7 out of 10 American adults who are self-tracking or think they are, but half are doing it in their heads. There are smaller groups who are using paper and pencil, about 1 in 3, and then 1 in 5 who are using some device, an app or website or a spreadsheet. Most are tracking, it's half tracking it on a regular basis, half tracking when something comes up, when something is triggered.
And can you talk about just what exactly a self-tracker is? There are some people out there who don't necessarily recognize that term.
It's a great question, and I think that it's really being defined as we move forward. I think that there have been some definitions of self-tracking that have come out of the life logging and quantified self movement. And then there's the self-tracking that I just described. And in order to create survey questions that we thought were valid, we actually went to different communities, and I did interviews, and I actually blogged and put it on Twitter to get feedback from all sorts of different people about what we should include in our definition on the survey. Mm-hmm. And so the delineation between tracking weight, diet, and exercise routine turned out to continue to be important, as distinct from health indicators or symptoms. And that also comes through when we look at people living with a chronic disease, 2 or more chronic diseases. 62% of that population tracks a health indicator or symptom.
Right, because I can imagine they're tracking their symptoms more regularly since they do have to deal with it over such a long time course.
Right.
Yeah. And so you mentioned before the statistic that 60% of Americans now track their weight, diet, or exercise. Mm-hmm. How has this number changed over time?
Well, that's what I'm excited about, that we're the first ones to do this survey work. So we haven't had data before, which is why I love to do survey data, because it puts numbers on things that people think they know. And instead of guessing, let's have some data, which is the role that the Pew Research Center can play. And it's a role that we often play in politics, as well as in education, civic life, and in this case, health.
Yeah, I'm sure so many people out there are very excited to see, how these numbers change over time as we develop more self-tracking apps, ways for patients to track their own data a lot easier than before.
Yeah, and actually, so I do have some data that's a trend, and that's about health apps. Mm-hmm. So for better or for worse, the trend line for health apps is flat from between 2010, 2011, 2012. It's still just 1 in 10 cell phone owners who have a health app. And so we're not seeing a big increase there. But we are continuing to see an amazing rise in the percentage of American adults who have a cell phone, and what's key, have a smartphone.
And why do you think that the number of Americans who are tracking using their cell phones has kind of plateaued over time?
With the health apps, you know, it's an interesting question about whether it's. I talked a little bit about people's privacy and information security and control, control issues that they might have about their data, and so that could be a piece of it because our health information is so personal. What people are tracking can feel very personal. And so they might not be sure that an app is really the place to put that kind of trust. And so that could be one hurdle. Another thing is that people might just not know which app to try. And so it's like being in a food court and losing your appetite. There's too many choices in an app store. How do you know which yoga app to try or which food tracker to try? And so people aren't adopting them.
So that's perhaps a potential role where physicians can come in and maybe give some advice about if you have a certain heart condition, you can use this app to track your diet, this app to track your exercise.
Right. And there is some interesting stuff going on. I know Johns Hopkins is doing some studies right now in terms of effectiveness of apps. And so that's something to stay tuned into that could be very compelling, that if there is actually clinical evidence that a certain app is useful, then that really could turn the tide.
Yeah, and we're just kind of pushing the envelope here.
Yeah,
just starting
it's just
to
the
see
beginning.
The revolution. It's very exciting.
Yep.
It's an exciting time. So you touched on the issues of privacy. And I just wanted to see if you could explore that a little bit more. You know, for obvious reasons, people are uptight about their health information. It's very personal. But do you see that kind of impeding the advancement of apps and self-tracking in health?
You know, it's a really so the way that we decided to ask about it in the survey was to ask about sharing. And so of the population that said that they were self-tracking, we asked if they share the data, either online or offline. Majority is offline if they share it all. 1 in 3 say they share. So 2 out of 3 say they don't share.
Right.
And it's just for themselves. And then of the 1/3 who share, half of those share with a clinician. And the other half share with a family member, spouse, member of a group. And so in that way, I thought that would be an interesting baseline to see where we are in terms of our attitudes towards sharing. And as we heard in the panel of the people who are self-tracking, when they did bring it to their clinician, they were mostly benign. I loved what Katie McCurdy said. Her doctor accepted it, but it wasn't that the doctor necessarily welcomed it. And so what I hope to do with this data is, again, put numbers on something that people wonder if it's happening, they suspect that it's happening, and maybe clinicians can start asking people if they are self-tracking, just to put that suggestion in someone's mind.
Right.
About whether they feel comfortable.
Yeah, and also for clinicians themselves to be more educated about different apps and what to do with the results that patients bring in, what sorts of questions to ask, like how to interpret the data, I think would be really useful too. That's something that we are definitely not being taught in medical school right now.
Right, exactly. Yeah, no, this is absolutely the beginning of a revolution. But what I like to always remind people is that, we have a lot of these patterns are pretty ancient. We have an ancient instinct to track some basic things about our health, and an ancient instinct to share that when we need to. And it's just now that the internet and technology is allowing us to speed up the rate that we're able to track and the rate that we're able to share, and spread the knowledge more quickly.
Right. Yeah, definitely. Speaking of knowledge sharing, coming from a research perspective, I can see data tracking or self-tracking as just a gold mine of information for research about what types of medication work, what type of lifestyle interventions work. What do you think about that?
Well, I think that when I look out at the landscape and I see different companies, I see nonprofits, I see government agencies, all trying to figure out, where this is going, I think that a fundamental question that patients need to ask themselves: what is the truth that I want to find out about myself? And I think healthcare entities need to ask themselves, am I ready for the truth? Am I ready to hear the truth about what really is affecting people's lives? So that's a question that I look at when I look at the future.
Yeah, and where do you see the future heading with your data? Are you planning to do more surveys? Are you
I would
planning to
love
do more
to.
data analysis?
Yeah, so since I just got this new survey data back, I really can't wait to get back to my desk and get back to my data in
Like
a lot of ways.
spoken like a true researcher.
I love to share it. I think it is so important to share it. I think that the more we understand what it means that 85% of American adults have a tracker, which is what I call my cell phone now.
Right, yeah.
I think the more we can understand how that changes us as internet users, as people, as citizens. As I mentioned, I think that the work that my colleague Erin Smith is doing in politics actually has a lot of parallels in terms of health, in terms of participatory democracy and participatory medicine. And I think that we need to continue to study all sorts of aspects of the social impact of the internet in order to understand these specific aspects such as health and healthcare.
Yeah, well, that's great. Is there anything else that you want to add or that you want to share?
I guess I would just urge everyone to continue to really stay focused on the present and respect the complicated lives that people are leading already, and notice the patterns of where people are already walking, so that we can lay down the paths to make it easier for people, and don't get exasperated if somebody doesn't, sort of take the path that you want them to take. Notice the path that they do take, and ask them what they need. I think would be my biggest piece of advice.
Right, so that speaks a little bit to patient empowerment and kind of seeing how the patient's path, exactly as you said, is going, and then making interventions that can fit the patient's lifestyle.
Absolutely.
Yeah. Well, thank you so much
Thank
for
you.
speaking with us and for being here at Medicine X. Your work is very inspirational.
It's my pleasure.